Colorado, we know, well known as one of the top places for research in the nation. There are federal labs and research facilities doing scientific research as well as medical research, all taking place at universities and hospitals. The Trump administration recently called for big cuts in research funded by the National Institutes of Health. Last year, there was an estimated $575 million in NIH funding for research here in our state. Alan Janae is looking into what the cuts could mean. Alan.
Not much yet. The Colorado Attorney General's office, along with 21 other states, filed a lawsuit, and a judge granted a temporary restraining order halting the cuts for now. It is here at the CU Anschutz campus that there are about 1,500 NIH grant recipients and about 7,000 people employed connected to that research. On the campus of CU Anschutz, these are worrisome days. In its labs, people work to find answers to medical mysteries, adding to the nation's reputation in biomedical research.
Our federal support, the steadiness of that, is a clear reason why the United States is a leader in the world. Dr.
Thomas Flagg is in charge of the overall research picture, and it has now grown very hazy.
We think it'll be a $74 million impact for the calendar year, as best we can estimate it right now.
The Trump administration is indicating the majority of that is to come from what are called indirect costs, which Elon Musk has called a ripoff. Aside from grant money, the NIH funds indirect costs to help maintain facilities. Some may have higher or lower costs due to location or the nature of the research.
There's biomedical waste, there's chemical waste. We are very careful about all those sorts of things. There's data storage needs, there's security around data storage. So it's really a rather elaborate infrastructure that's required to do this research.
Flagg says what worries him is plugging the holes with a sudden loss of funding.
I think one of the things that concerns me, these recent announcements, is the magnitude of the change and the rapidity of the change. It's happening very quickly.
Putting Anschutz and the researchers in a bind.
If our funding suddenly changed by $74 million, it would have a very dramatic impact on all the things we're doing, versus a longer-term discussion, gradual changes, and agreement about how we should change things over time.
You'd be open to that?
I think that the conversation makes a lot of sense.
Dr. Flagg, who is himself a bladder cancer researcher, is now spending a fair amount of time explaining how grants work, how difficult they are to apply for, and how difficult they are to get. Has the research here stopped? No. The judge's order means it continues for now. So that means things like cancer research and drug trials are still going on. In Aurora, I'm Alan Janae, covering Colorado First.